Foxworth, president of ChiroHealthUSA. And I'm here today with one of my colleagues, someone who has become a dear friend, and quite frankly, one of my mentors over the years. And Jay, not to put you on the spot, but I want doctors to know what commitment looks like, and I think you are the definition of that.
Thank you.
So if you don't mind, give me the short list of 20 or 30 things that you're involved with today.
Sure. I'll break it down into really two areas of work. One is just my private business. So we have 5 chiropractic rehab clinics. We have a wellness company. We have a clinical research foundation. It's a 501c3. So we run clinical trials in our practices. We have our own institutional review board that was approved by Department of Health and Human Services. And then we have a consulting company where we really do a few things. You know, one thing that we do is we teach. I do a fair amount of speaking, you know, around the country and around the world. But we also partner with technology companies, and now we're building technology to improve positive impact, linking really technology and healthcare together. So that's really, really exciting for us. So that's kind of the private side. The policy and advocacy side in chiropractic is the following. So I'm chairman of the Clinical Compass, so we create clinical practice guidelines for the chiropractic profession. I'm also chairman of what's called the World Olympic Scholarship Program. This is through the Federation of International Chiropractic and Sport. What we do is we connect Olympians with participating chiropractic colleges and universities so they can get full ride scholarships to chiropractic school. We've had 5 Olympians go through the program thus far.
Wow.
I'm also the president of what's called the East Coast Association Independent Physician Network. So it's a 3-state association-owned network. It's Maryland, Virginia, and Pennsylvania chiropractic associations getting together in order to deal with some of the, I'll use the word injustices that we face in the reimbursement world today.
So one of the other projects that we work on together that you asked me to participate in was the Clinical Compass. And I'm a guy who practiced when the Mercy guidelines first came out. And it used to be when you heard guidelines, it was kill it first, ask questions later. What's different about the Clinical Compass?
I think the opinion around guidelines has changed over time. I think the profession has realized how important leveraging the literature is. When we think about healthcare in general, we know the definition of evidence-based practice is the latest available scientific evidence, physician knowledge, and patient values. And those things combined really is creating evidence-based practice. And doctors are now learning, because we've gotten better at knowledge translation, doctors are now learning how they can use a clinical practice guideline to educate their patients for better compliance, educate other healthcare providers on what chiropractic actually is, educate the payers so we make them pay the bills they need to be paying based on the evidence that exists around frequency and duration of care. And also using clinical practice guidelines to change policy, you know, at the legislative level, at the insurance level, and I've seen this firsthand. So as we have more successes using clinical practice guidelines, people are like, oh yeah, maybe these things aren't so bad, and they realize that it's not so dogmatic.
So for you, those of you that don't know about the Clinical Compass, it's a group of volunteers. And so where do you find the people that are willing to do this work for free?
Yeah, I'll tell you, it's interesting because each COXA district, each Chiropractic Congress district has a rep that, you know, is kind of voted in to our Clinical Compass board, but you also have people that have kind of grown up and all of a sudden become really, really passionate about what we do. When I first got on the Clinical Compass board, I'm like, what is this? Like, I'm a sports chiropractor. What am I doing here? But as you start to learn about the impact of these guidelines and how important they are, you become really passionate about it. So it's a little bit of a push, and then all of a sudden it becomes a pull. You want to pull more people in. So we've got great people on our board like yourself, and we are poised to do even better things in the future.
Great.